Thank you, Tracy. I have the pleasure and honor to be on this panel and in this discussion, and going to talk more about hookah as the connection to what Dr. Milner kind of started. Everybody can see my slides?
Yes.
Great. Okay. So, sorry. So here are some, I'm pretty sure all of you have seen the hookah and know what it is, because that's become so prevalent. But basically, it has this top head where you put the tobacco and the coal, and it burns, and then people suck the air so that the smoke goes through these bubbled water and then to the person inhaling it. And so that's kind of the traditional one, and there are many forms from that now. And basically, the hookah produces almost 10 times that of a cigarette, because people stay about an hour long and using the pipe, the water pipe or the hookah. So it's more problematic, especially if somebody is using more than one session. And it's similar to the cigarettes in terms of the components. It also has coal that is burning, that is not in cigarettes, and that produces carbon monoxide. Also, there's these sugar molasses produced, and when they burn, and to give it the taste and the aroma, and when they burn, they actually produce more carcinogens than tobacco by itself. So this is an added problem. It's addictive, I can tell you. I have seen it and know people who are addicted to it. They cannot go without having at least 1 or 2 times of hookah settings a day. They have been shown to be related to cancer, all type of cancer, oral, lung, stomach, related to heart disease, low birth weight among infants, to mothers who smoke hookah. And also the mouthpiece can spread the infection, because in many cases it's shared by people. And with COVID-19 and other infectious diseases, this is a big problem that really is not mitigated by just changing the mouthpiece. That's not enough, because the tube is going to be the same tube that people are breathing in. Also, those people who are not smoking it but around it are being exposed to secondhand smoke, that's for sure. In the US, on average, about 12% of young adults report using it in the past year, and up to 20% in large cities. So in large metropolitan cities, there's more use of this. In high school students, about 7.8% of them use it. And now we have different forms like electronic, portable, and other forms that is, adding to the niche and the excitement about this hookah that goes way beyond what the traditional hookah was supposed to be. In addition, that is not part of the tradition of this use of tobacco, is that there are flavors. Everything from chocolate to cappuccino to licorice to watermelon, you name it. It's just their imagination, and the chemicals that are put there are also not regulated for being inhaled, that's for sure. And they are being used very, widely for this. The industry of hookah is using the same tools that the tobacco industry has traditionally used. So adding flavors to lure the young and otherwise non-smokers as a way of getting them addicted to tobacco. There has been a paradigm shift away from tobacco in the last 2 decades or decade, thanks to programs like the California Tobacco Control Program and other programs. The social norm has shifted away from the cigarette. So the hookah is a way to bring it back again as something that is cool. Those of you who are old enough know the Joe Camel campaign, showing that it is cool to smoke cigarettes, and it was targeting young folks in 1987 until it was stopped by law in 1997. And that's kind of appearing now through the hookah, that it is for happiness, friendliness, being wild and having fun with these kind of images about hookah. In addition, there's a connection here with being cool and the mint flavored and other products that are targeting the Black community of the US and the world. So you can see these connections coming back, and also the misuse of culture. So what are the hookah use myths? First, that it is less harmful than cigarettes. As we discussed, it is not, but that's a myth that is widely spread by the users as well as the producers. The other myth is that water clears and cleans the smoke, which is not true. The air goes through the water and it still has all the components that is inhaled to the lung. So nothing is pure about the water cleaning it. The smell of fruit and aroma suggests that it has nothing harmful, which is again a totally wrong information. And then what we're talking about today is that it's part of the heritage and the culture of the Middle East. And this is a hookah lounge. You can see how it looks very traditional and very, culturally relevant. And it is not actually part of the culture. So who speaks for the culture? And that's kind of the thing that we want to relate to people who are here, and including those who are coming from the tobacco industry. They need to listen to this and learn that the culture is a set of norms agreed upon by the majority of a group of specific population. That's when a culture. It can't be that people who are selling these products who speak for the culture. So those from the Middle East who are making a living out of selling hookah or running hookah lounges do not speak for the culture. They are speaking for their own business and profit. So that's something very important to differentiate. And so what is needed and why we are talking today about this? We need to address this from different perspectives and address this misuse of industry about the culture. First of all, if anybody is going to raise this issue of culture, ask them about their conflict of interest. Let them declare it, whether it's in a public or in a setting. Do you have a lounge? Do you smoke hookah or use hookah? Because that by itself is a self-conflict or interest of conflict, just like we were asking smokers back in the 70s not to smoke. And they're smokers, they're addicted. So that's one thing we need to address. Ask them, why were cigarettes used and still used more than hookah among the older generation of those people of this descent from Middle East? If this is part of the culture, why isn't hookah used more than cigarettes? We know cigarettes use is epidemic in the Middle East and among those people who are of Middle Eastern descent here. They are higher users of cigarettes than hookah, that's for sure. So that defies or undermines this kind of claim that it is part of the culture, because it is not. This is an important historical thing that no one, not even the tobacco industry, can undermine. If hookah traced hundreds and thousands of years to the Middle East, when it was discovered in North America, how can tobacco being discovered in North America, which is a fact nobody can deny historically, be part of a tradition of the Middle East which goes thousands of years ago? Thousands of years, the Middle Eastern population was established from the Babylonians and afterwards. So it doesn't make sense. What happens is that this was introduced later on by colonial powers and mostly the Turkish Empire to that region from Europe. So they got it from Europe. And then again, not allow those to falsely speak for the whole culture, that is, and say that independent people from the region who live there told you this is not part of the culture. I can tell you, I lived in that region as an adult, as a physician, and it was never part of the culture, that it was something looked down at. Cigarettes were part of the culture. A lot of people smoked, but that doesn't mean it is part of the original culture of that region. And so that's something to really know. It became a trend probably a decade ago by lounges and cafes and selling hookah, but it's not part of the culture. So, and then finally, we need to come together with research and evaluation projects to address this phenomena. And also the target communities should be working together like we are doing now, because there's power in unity. And I want to end with a story that shows why we really need to work together, and that I kind of saw recently in the Union Tribune, San Diego Union Tribune, that Arab Americans and Black Americans are coming together to address discrimination against them. And this is really something we need to do as communities against the industry. Thank you.
Thank you so much, Dr. Al-Delaimy.